Hi, everyone. Welcome, welcome. Thank you for joining us for this third day of face-to-face virtual programming. We're so glad to have you all here. This session is arts-based social prescribing, expanding access to well-being through the arts. We're so thrilled that you can be here with us. My name is Kinsey. I use she, her pronouns. I am a white woman with brown hair. It's pulled back in a clip today, and I'm wearing some large, round, wire-framed glasses and a cozy tan and white sweater. And my background is blurred. And I'm also the programs director here at the New York City Arts and Education Roundtable. Although we are currently meeting on Zoom online via an online platform, the Roundtable would like to acknowledge that we do work and live on unceded lands. Mannahatta, or the place that is also known as New York City, exists on the contemporary and ancestral homelands of the Canarsie, Munsee, Lenape, and Wappinger people. These sovereign nations and communities are still thriving here, and we continue to occupy their lands. So we would like to give a moment of respect to them, as well as to the Black and Brown and immigrant communities, which have helped to build the city that we know today. As we recognize that all of our past, presents, and futures are intertwined, we'd like to again uplift a handful of contemporary Indigenous arts organizations that we feel we can all learn from and support. So I'm just going to paste those links in the chat if you haven't before. Highly recommend to save those, check out these organizations, support them with donations if you can. And if there are any similar organizations that you would like to highlight and share with the folks who are here today, please, you're welcome to do that in the chat as well. Thank you. Alrighty, before I go any further, I just have to say a very, very big thank you to the conference sponsors for Face-to-Face 2025, without whom we would not be able to offer such a robust program, including these virtual sessions, as well as our in-person conference next week. So we're just so grateful to them for their support. This session specifically today is brought to you by the 4 sponsors with their logos that you see on the screen here. So just a really big thank you to Magic Box Productions, for Global Arts to Go and Get Empowered. Those are kind of sister organizations that work together. We're also grateful to the NYU Educational Theater Program and to AATE, which is the American Alliance for Theater and Education. So thanks to them all. If you're interested in learning more about any of the conference sponsors for Face-to-Face, you can learn more about them, find links and information on the sponsor page on the Face-to-Face website. Alrighty, I will stop my screen share, and just a couple more reminders. If you're having trouble with Zoom at all while you're here, please just send me, Kinsey, a private message. I'm here to help. Please just keep your mic on mute unless you're the person speaking, so we can all hear each other clearly. We do encourage you to use the chat and connect with others on the call. You can also put any questions you have in the chat. We're going to collect those, and we'll address as many of them as we can as we get to the later part of the session. As you can see, this meeting does include live ASL interpretation. We also have automated captioning available via Zoom. To turn that on, you'll just find the captions button on your toolbar or under the More section of your toolbar, and then click Show Captions, and they will start populating for you. And this session is being recorded. This and all the other recordings and resources will be shared with conference registrants after the conference has concluded. So look for that email from me soon. And I think that's it on my end. So let me add a spotlight here, and I will pass the mic. Oh, there we go. Over to Adrienne Hundley from Art Pharmacy. Welcome, Adrienne.
Hi, Kinsey. Thank you. Hi, everyone. My name is Adrienne Hundley. I am a white woman with messy, curly, dark brown hair. Again, with the cozy tan sweater and a blank background. We would like to start everyone off today with just taking a deep grounding breath together. We are really honored to be part of this conference. And so to land in this space together, please join me in taking a big deep breath in and out. We'll be talking a lot about wellness and well-being today, and knowing that this is part of a virtual conference that is embedded in your regular work week, we want to make sure that we've got the time to acknowledge that we're all landing here from different places and to just welcome you to be present in this time. And we are curious, Ginger and Allie and I, my co-presenters, um, to hear from you all about what wellness means to you or what well-being looks like to you. And we'd like to get your responses and create a little word map so that we kind of have a sense together of what this means to us as a group. So if you want to follow this link to start to respond to the question, what does well-being mean to you? I will share our collectively created word cloud. I see balance and happiness, community, peace, peace coming in hot, health, whole health, mental wellness, strength, feeling grounded. So seeing both the mental and the physical, calm, community, time, family, acceptance, happiness. Really beautiful. Confidence and energy. And even through it all, peace being the thing that rises to the top, peace and health. Wonderful. Thank you for sharing. I think you'll hear a lot of these elements reflected in our conversation today. As we get started, I'm going to be starting us off today with a kind of framing of social prescribing. And then we'll also be talking through a couple of different implementations of what this practice looks like in real life, and then be thinking about this practice as it gets to accessibility and this question of how we think about inclusivity and accessibility, both in kind of the educational framework, but also in the larger kind of community-based program world. So, Kinsey, if we'll get started, we'll jump right in. All right, so we're talking about arts-based social prescribing today. I introduced myself as Adrienne. I lead the Community Partnerships Department at Art Pharmacy, which is a social prescribing company based in Atlanta, Georgia, that has been filling prescriptions for arts and culture over the past 3 years in North Georgia. We also work across the state of Massachusetts, in California, and as of last month in New York City as well. Next slide. So what is social prescribing? Social prescribing is a practice. It is a means of enabling health professionals and other trusted individuals in the community to prescribe community-based social interventions as supplements to traditional clinical and pharmaceutical care. Next slide. As we think about arts-based social prescribing in particular, though, it is this overlap, or I think of this marriage between the practice, the mechanism of social prescribing that connects people to community-based, non-clinical interventions that support healthy behavior, social connection, developing of relationships, with the field of arts and health, which has primarily lived in academic institutions over the past 40 to 50 years that have demonstrated the both physical and mental impact that engaging creatively has on our bodies. When you put those two together, we get this beautiful space of arts-based social prescribing. That's probably one of the primary areas in the US that social prescribing has taken hold. Social prescribing is a practice started in the UK in the late 80s, early 90s, and includes a larger umbrella that includes social services, housing, food, transportation, as well as activities like arts and culture, volunteering, and time in nature. In the US, when we talk about social prescribing, it's most often in those fields of arts and culture, nature, and sometimes food on prescription. Next slide. So we talk about this narrative, the arts and health field pulling in as well. And I love sharing this quote from the Neuro Arts Blueprint that for me as a theater practitioner, not a science person, just blew my mind to read because it, I think, illustrates so well what I have felt and seen in teaching, that physiologically, the stimulus from art on our senses causes a cascade of reactions that affect multiple biological systems and alter our brains and bodies. In short, we are wired for art. So we get this field of science that is supporting and backing and demonstrating what we as artists have known and felt, that artists have done since the beginning of time. So it's in this space of both science and research and practice that we overlap it with the mechanism of enabling this referral pipeline to come away with arts-based social prescribing. So that's the down and dirty of kind of what arts-based social prescribing is. Next slide. And I like to think about this also in the framework of the larger field of arts and health. So you'll see there's kind of these three columns that I like to picture. One is in creative arts therapies, which is the practice where clinically licensed professionals use arts-based activities to help treat emotional and mental health conditions. And then you've got another column that is arts in health. What do we think of like co-located programming that integrates arts into healthcare settings? So, think your bedside music programs, artists in residence, concerts in hospitals. These are often non-clinical practices, but they don't have to be. And then you've got the arts-based social prescribing field that is really rooted in the community. It is not a non-clinical practice, and is this mechanism that helps these two fields of healthcare and arts and culture, that that have historically been ill-equipped to work together and speak to each other, to help narrow that gap and make it possible for us to really leverage the power of arts and culture to support well-being. Next slide. There's been some really great research on social prescribing that is showing both the um, mental health effects around self-esteem and confidence, research that is showing the impact on physical health outcomes, like improvements in mobility, pain tolerance. And then also it shows impact in the spaces of social connection, reducing loneliness, isolation. And a recent study that came out of Canada that shows on the cost savings as well, that for every dollar invested in social prescribing, it saved $4 on the healthcare side. So there's lots of reasons that that we are trying to work to expand and get wider adoption of social prescribing in the US. And also, probably not surprising, why it has been a slower adoption process here in our fragmented healthcare system than it has been in other countries that have a more socialized healthcare system. Next slide. So as I think about, why now? Why are we having this conversation now? There are a couple of different trends that have come together that make this a real kind of meet the moment chance for the field of arts and culture to step up and meet. And those are in the traditional healthcare space that is moving towards a value-based care model that is trying to reward preventative care. An additional recognized need for mental health supports post-pandemic, when we all experienced firsthand that lack of connection and lack of community engagement that left us really desperate for that coming back. Coming out of the pandemic as well, it really highlighted the mental health workforce shortage that has turned the healthcare industry into looking for solutions about how they fill this gap, and being able to come in and say, look at these really incredible resources that are already doing work in your community, is a really great way to do that. Education, the arts and education field knows this better than anybody. But the social emotional learning pathways that teach sensory learning and awareness and emotional regulation and resilience are have become part of the mainstream conversation in education spaces and are being able to be utilized and recognized in other sectors as well. And then, changes in the arts and entertainment sector as arts organizations are looking for other ways to reimagine traditional revenue streams, as they're looking for new ways to engage audiences, new audiences, those who have been kind of historically marginalized from the art spaces, and thinking about more explicitly connecting art to individual and community health. All of these trends in various sectors, we're starting to pull together and have those conversations in the same room. Next slide. So who is Art Pharmacy serving? We serve Medicaid and Medicare users across, I said this earlier, Georgia, Massachusetts, California, New York, building out in Connecticut and a couple of other smaller regions later this year. But we see this as a way to get folks who are either low income or under resourced in their healthcare space. So Medicaid and Medicare users, students in higher education, communities, general broader communities through public health initiatives, and then individuals with chronic health concerns are four of our kind of primary audiences that are using social prescribing initiatives at this point in time. I'll go to the next slide. I'm not going to go into depth here. This gives a little bit of a framework of kind of what a member at Art Pharmacy would experience, but Allie's going to go into a really great example of a local version of social prescribing happening with NJPEC in Newark. And so I'm not going to double dip here, but just so you have kind of a sense of a journey, this pipeline goes from a referral to a care navigator. Somebody coming into Art Pharmacy gets connected with a care navigator who learns somebody's arts interests and health goals and access needs. And then they end up participating in an arts activity in their community. And then it comes back around to the healthcare provider with all of that information of whether they've participated, what impact it's had. We do well-being assessments, et cetera. And that's that kind of closed loop system that really makes social prescribing, I think, really powerful. So I'm going to pass it over to Allie at this point in time to talk through kind of the implementation of social prescribing in the community, and we'll go from there.
Thank you, Adrienne, and hello, everyone. I am Allie Meyer-Lakuta. I am the AVP of Arts and Wellbeing at the New Jersey Performing Arts Center. I'm happy to be with you all today. Thanks for joining our virtual presentation day. I am a white woman with gold wireframe glasses and gold earrings and a white sweater, brown hair, and a blurred background. So as Adrienne said, I'm going to be talking a little bit more about an exact arts referral program that we implemented in Newark, New Jersey through the New Jersey Performing Arts Center. And this slide is just like one of our kind of core beliefs and values that performing arts centers are community health centers. And Adrienne touched on some of the evidence before, but the field of arts and health is really broad. Field of practice, research, and education, all to understand and amplify the fact that the arts are integral to our health and well-being. And just by being witness to arts experiences and engaging with arts in a participatory way, we are enhancing our health and well-being. And so we believe that, performing arts centers, community arts organizations are centers of health in our community. You can go to the next slide. So at NJPAC, which is what we call the New Jersey Performing Arts Center, we're taking a really comprehensive approach to our arts and well-being initiatives. These approaches include an arts and health research lab, programs in healthcare spaces, programs in community, developing training and education, and ArtsRx, which is our Arts on Prescription program that I will go into a little bit more in detail. You can go to the next slide. And we believe that all of these pillars act in an ecosystem where our education and training are building capacity for our direct service programs, that our research lab allows research and evaluation of those programs for feedback and improvement so that we have evidence-based learning, and that we can engage students and folks who can learn more earlier on in their lives. We like to spread the good news, right? That the arts are good for your health, that, as you give yourself a pat on the back for hitting 10,000 steps or, eating well during the day, that if you're practicing something creative, whether it's, practicing your guitar or singing in a choir or singing in the shower, that you're doing something good for your health as well. But we also want students to learn that as part of their curriculum, and so that they can bring those practices into their professional practice in the future too. You can go to the next slide. So this is a very busy slide that shows kind of a pipeline of our Arts RX initiative. And on the left, we have all of our health and social care referral partners. In the middle, we have the process with which someone goes through the Arts RX program. And on the right, we have our myriad of arts partners in and around Newark that deliver arts programs to all of the participants. But 3 years ago, almost 3 years ago, when I first came on board at NJPAC, what we had in place was the next slide. A bunch of question marks, right? We knew that we wanted to do something around arts prescribing and social prescribing, but we did not have any of the pieces to the puzzle. Who would be the referral partners? How would people get into the program? What would they do once they were in the program? And where would they go to find their arts prescriptions? And so I'm going to talk a little bit about the process that we undertook to kind of fill in answers to each of these question marks, which took a full year of planning and a lot of listening and community involvement and a lot of partnership. You can go to the next slide. So I came on board in this role at NJPAC in the summer of 2022. And our first kind of proposals were to have a couple of roundtables to gather a coalition of enthusiastic partners. So we brought together a healthcare roundtable with folks like RWJ Barnabas Health System in New Jersey and Horizon Blue Cross Blue Shield. And we got those health partners to say out loud how much they valued arts and culture as a part of their care for their patients and community members, and that they really believed that the arts help drive health equity, and that access to the arts was an important component of care for their kind of communities. Then we brought together a whole host of our local arts organizations. And here is my pitch. You don't have to do anything new. Just tell us what you're doing, and then we'll pay you and send people to those programs. Does that sound like a good pitch? And people were like, all the arts organizations were like, yeah, that sounds pretty good to us. But I'll say that, I brought up in that roundtable some of the data that Adrienne referred to, and the folks from these arts organizations were really eager to learn more about it and to understand the work that they were already doing through the lens of health and well-being. And so we've been having continued conversations with these folks about that. So once we had our healthcare partners identified, which ended up being Horizon Blue Cross Blue Shield of New Jersey as our inaugural partner and really thought partner in this work, and we had our arts partners identified, we had to figure out a referral process. And our IT team really stepped up to the plate and created an incredible system in our Salesforce for Nonprofit module to track someone's journey through the Arts RX program. And we decided what someone would get as a part of the program, but I think I have that in future slides. We had to build that system out in Salesforce. We had to train who we call our ArtsRx connector, which is that care navigator role that Adrienne described. We needed to train the folks at Horizon that were going to do the referring. We had to create collateral and materials, and we had to test it. And so if you see, from the first square all the way to almost the last square, that was a full year of planning before we finally implemented in September of 2023. We brought on Rutgers Newark as our first expansion partner, making this program available for student mental health services in January of 2024. And now, as you saw before, we have 6 referral partners, a myriad of arts partners, and we've just entered phase 2 of our program. So our kind of pilot phase is over, and we're entering into like a longevity and sustaining phase. You can go to the next slide. So now I'll just walk through kind of quickly what someone's experience is like Adrienne was describing. So our referral partners are Horizon Blue Cross Blue Shield of New Jersey, Rutgers Newark Student Mental Health Services, a federally qualified health center, or FQHC, at the City of Newark Department of Health, another FQHC at RWJ Barnabas Health, Returning Citizens Support Group, which is a community support group for formerly incarcerated folks and their family and loved ones. And our most recent addition is our own employees at NJPAC as folks who get to sign up for the program. So we say, first step is making the referral. Oh, and you can go to the next slide. I'm trying to click through. And what we tell the referrers is that, anyone can benefit from engagement in the arts, but the ArtsRx program is particularly beneficial for those experiencing chronic illness, social isolation, loneliness, folks who are caregivers, and those experiencing some mental health challenges. And we have a little asterisk around that. This is not a clinical care. And so we want someone to be stable in whatever mental or behavioral health journey they are in before they enter into an ArtsRx program. You can go to the next slide. Folks who get a referral receive a prescription for 6 arts activities to be used within a 6-month period. Each activity they sign up for, they can bring 3 guests with them, friends, family members, so they never have to go alone. And participants never pay for an activity. We pay for the activity for them. They don't have to choose free activities. We pay the arts organization. So, when someone signs up for a glass blowing class and they bring their friend, their child, their loved one, we're buying those 2 registrations for them, and we're taking care of the registration process and sending them on their way. So all they have to do is just show up. I think next slide. After the participant attends each activity, a short follow-up survey is sent. And once the survey is completed, they're ready to select their next activity. This process repeats until they've used all 6 activities or 6 months has passed, whichever occurs first. We also incentivize the final survey for them. So we have a higher completion rate after they've completed the program. You can go to the next slide. Oh, that's what I just said. And so we have a pre-program intake form assessment and this post-program assessment, and we're tracking some metrics like loneliness, social connection, and self-efficacy in the pre and post program surveys. Next slide. This is just an example of some of the referral resources that we give our referral partners so they feel really equipped to deliver these arts prescriptions. often these are folks like community health workers who are really familiar with, if someone says, "Hey, I'm having trouble putting food on the table," they know to give a food prescription, right? They're sending you a referral for your local food pantry, or if you need housing support or education. These are tools that they have become, adept at using. And an arts tool in your toolkit is new. So we wanted to really equip the referrers with a lot of resources so they felt really comfortable making this referral to their patients and participants. Next slide. And this is just a quick look at our dashboard of some of the metrics that are captured within our Salesforce system. You can see, right now we have, this number is from yesterday, but now we have 93 currently enrolled participants, and, uh, that they've attended over 700 arts activities. We track whether they're observational or participatory, what kind of modality people are choosing. You can see crafts and music and theater are really popular. That glass blowing classes are really popular. So our classes, performances at the New Jersey Performing Arts Center. But this is a module that's within Salesforce. So our IT team has also suggested that this is a packageable kind of module that is within Salesforce that they've created, and Salesforce for nonprofits is free. So we have the potential to be able to share this with other nonprofits that want to do a similar pilot program on their own. And I think that's it for me. So I'm going to pass it over to Ginger.
Thank you, Allie. Thanks, Adrienne. Hello, everybody. My name is Ginger Mayer. I'm a white woman. I'm wearing a black top. I have big black chunky glasses on my face. I have strawberry blonde hair piled up on top of my head. I'm sitting in my office in Midtown Manhattan, and there's lots of artwork behind me. I am the Vice President of Programs for TDF, formerly known as the Theater Development Fund. And we are the nation's largest nonprofit arts service organization. Our mission is to remove the barriers to theater going so everyone can attend, because we believe that theater belongs to all of us as a cultural and well-being value. We envision a world where the transformative experience of attending live theater and dance is essential, relevant, accessible, and inspirational. And we do that in a number of ways. If you can advance the slide, please. First and foremost, our programming falls into roughly 3 different categories: expanding access, cultivating communities, and supporting the makers. And we have some core initiatives around that that I will walk you through. In a given year, we serve about 2 million people in and around the New York City area. Please advance. Perhaps our most recognizable program is the TKTS booth in Times Square. This booth sells half-price tickets to Broadway shows day of. So with a little spontaneity, you can get a great discount, and anyone is eligible to walk up, get in line, and buy a ticket day of. That helps eliminate one of the most significant barriers to theater going, which is price. But that's not enough. So we have an entire suite of programming, if you can please advance again, that I put all on one slide for maximum condensed text, but I'm going to walk you through a few of them. We serve roughly 50,000 people a year through our programming, and the programming really aims to get granular and dive into the reasons that people can't attend or won't attend theater. So accessibility is a big part of that. Through our TAP membership, we make sure that people have access to seats that are downstairs in the orchestra of Broadway theaters. So if you have mobility issues, if you have vision issues, or if you have hearing issues, you can see, hear, and experience the show as best as possible on your terms. We also have an accessibility program for students where we make sure that when we buy out full houses of Broadway shows, students also have the same tools we're offering to the adults. ASL interpretation, open captioning, and audio description. We have autism-friendly performances. We're working towards being able to provide 12 a year, or roughly once a month, for folks who are in our curated autism impacted community. I'm sure that you have probably put together by now from both Adrienne and Allie's presentations that repetition is a very important part of intaking the art and receiving the benefits from it. So we want to make sure that we have selections for our families and individuals impacted by autism to go to the theater at least once a month. What we do is we buy out a full house and we make sure that it is sensory friendly. We train the cast, we train the front of house, we invite a select group of people, we lower the lights, we lower the volume, and we have a staff of clinicians on hand there to support people. Very high level of support in the theater. Different than some other programming you may have heard about, like Seats on the Spectrum or sensory-friendly performances, which are a lower level of support so that people can self-select what they feel comfortable with. We have the TDF Veterans Theater Going program, which is fairly self-explanatory. It gets veterans into seats. Our community viewing partners with big community organizations that are located geographically or culturally around the city and provides free tickets to their constituents. And then our introduction to theater and dance seats about 11,000 students per year on Broadway for free, with in-class teaching and learning opportunities with professional teaching artists. And then our Wendy Wasserstein project is a small group of students who are going with a mentor throughout the year to see 6 shows throughout the season. Again, repetition. And then afterwards, they talk about how that makes them feel. They talk about the social and emotional learning aspects of their adventure. If you can go to the next slide, that might be it. Yep, that's it for the TDF overview. And you might be wondering, why is TDF included in this panel here, since we clearly don't have an arts prescription program, as it were. But I think that Allie's point, if a performing arts center is a community health center, then we can look at theaters as places for community health. And to Adrienne's point, that care navigators talk to and think about what a person needs and then says to them, this is an opportunity for you to go see this piece of art, then the army of teaching artists working in and out of classrooms every single day in this city and community workers are also people who are doing social prescribing work, but they might not yet have that name for it or that formalization. TDF also believes that every single New Yorker has a right to get to the theater, and arts and social prescribing legitimize another pathway to that. So that, maybe your rough and tumble uncle who's not an avid theater goer because he thinks it's something rich people do, has someone who says to him, this lowers your blood pressure, this makes you feel better, it takes your heart rate, keeps it a little lower. If you go repeatedly, you feel better about yourself, you feel more connected to your community. It legitimizes that for that individual. It makes it as important as eating a good breakfast, brushing your teeth, and making sure you go to the dentist. So this movement towards arts and wellness, as Adrienne illustrated, is one we've known about for quite a long while. But arts prescribing and social prescribing legitimizes it in such a way that you can cut through a lot of red tape or bad thinking. It also is difficult to argue with. This is good for you. It's good for your well-being. It's good for your body. It's good for your mind. It's good for your emotions. There's nothing controversial about that. We want people to be healthier. Almost all politicians can agree on that in some way or another. So again, it's another legitimizing strand for getting people to experience art and adapt it as a cultural value and create habits around it. Much like our friends in the UK, who benefit from a completely subsidized healthcare system, they've seen greater benefits because it's baked into the culture. And this helps us move more towards that. That's the little TDF piece there. So I'll turn it back to Adrienne because I think we're going to open it up to some conversation.
Yeah. Thanks, Ginger. Thanks, Allie. We have I have a couple of questions that I would like to pose to you both as we think about social prescribing and how we make sure that as this kind of new mechanism is designed, that it remains accessible, and we're thinking about accessibility in that design. As I ask questions, I encourage all of you in the audience listening to also start to drop your questions into the chat. This is a time that we can really be in conversation. So please feel free to throw whatever you are curious about in the chat, um, or raise a hand, and if Kinsey can see you, or if I can help see you, help moderate that to come off and ask some questions. To kick us off though with conversation, Ginger, I'd love to kind of pick up on that piece that you were talking about with this army of teaching artists. And as we talk about accessibility, and we're often thinking about that in the way of accessible to participants, accessible to audiences. Um, I'm curious, in this, this can go to both Ginger, you or Allie. Um, what types of programs and organizations do you think are the best fit for social prescribing, and therefore may benefit from social prescribing? And how are we thinking about not creating, um, more boundaries amongst arts institutions and organizations and individual teaching artists? And has that come up in your thought and conversation, Allie, as you were working with developing partners and networks, and Ginger, where you maybe see openings for various sizes of institutions of how they can respond?
Absolutely. I mean, the thing that I like the most is that you could partner up with an unexpected arts supporter. Yes. So our veterans program, I think, is an interesting point here. We made a lot of assumptions before we started this program about what veterans wanted and what they didn't want. And we're delighted to learn, in fact, that they want what everyone works: social connections, community connections, the ability to empathize and see something and have catharsis, and the ability to talk to each other openly afterwards. And so when we began to go more into the world of arts and wellness and look at arts prescribing and social prescribing, it occurred to us, what if we were able to partner up with organizations that were maybe a little not intrinsically valued, or no, let me put this right. For perhaps the culture of participating in art just isn't part of it yet, right? So we're thinking about city employees, like all the Con Ed employees or the MTA employees or the entire brigade of the New York City firefighters, right? How do we get them involved in art going and creating and culture? And I think that the social prescribing piece and the arts prescribing piece give them an opportunity to do it without any sort of real risk involved. You're not spending hundreds and hundreds and hundreds of dollars of your own money. You're doing it in support of your own health, right? So again, kind of going back to the idea that there's nothing controversial about this. Everybody should take care of themselves. My doctor told me to go see a play. Great, I'm going to give that a try. And you're doing it in support of the research and metrics as well. You're participating in something that actually helps everybody around you and creates a little bit better civic engagement, and that's all worthwhile. So, if appealing to someone's emotions doesn't work because that's not who they are, appealing to their sense of wellness and social wellness and civic wellness is an entirely different application, an entirely different route that once again legitimizes creating that habit. Allie, over to you.
Thanks, Ginger. I second all of that. And I hear the voice of our president and CEO in my head when I think about this, John Schreiber, where he talks all the time about how there is little to no barrier of entry to these programs, whether it's our Arts on Prescribing program or community-based programs, healthcare, you name it, that, anyone is a potential partner and kind of anyone is a potential participant, right? And as Ginger was saying, anyone can benefit from increased engagement in the arts. The dosage doesn't have to be that high. We see one or consistent engagement once or twice a month really has marked health benefits across the lifespan. And so I love that when we can, have these unexpected and really fruitful partnerships. It's in the name, right? Arts and health, right? You don't have one without the other. It's inherently cross-sector, and that arts and artists also are fertile ground for those kinds of innovative ideas that can break the mold and advance health in ways that, our current system doesn't allow.
Yeah. I think, as we saw in the word cloud at the beginning, like there's a little bit of consensus around what well-being is to people, but there's also all these different variations. And I think one of the most beautiful pieces that we see in the network building, where we at our pharmacy go out and basically community asset map the areas that we're serving for your large cultural institutions, your small community-based organizations, even your individual teaching artists that are already doing work in the community, because the different ways that they work with the community means that they're able to work with, and make really personalized the experience for folks that are looking for different things in their own well-being journey. So for the person who is looking for the way to unplug for an hour and just take a brain break, de-stress, um, lower that heart rate as Ginger uses in her example, that means that they're looking for maybe one type of programming, and somebody else who's looking for social connection and to build relationships and is feeling really lonely and wants to meet people, meet their peers in their community and feel connected, might be looking for something that's really participatory, that they can dig their hands in and be part of the creative process, or be in conversation with others. And so, thinking about when we think about network building, we are a more the merrier network, because, as I see it, if we are able to match one person to you, or if we're able to match 100 people to your programming, that is incredibly valuable to those individuals that had their particular goals and interests met. And like, when does that happen in healthcare? When do you say, this is what I love and this is what I want, and that thing comes together in one place?
Yeah, I think that's a great point. I would add to it, it sees something through in many ways from beginning to end, right? It can be very frustrating to go to your doctor or to go to a therapist, and they're like, well, you need this, this, and this. Best of luck to you. You're an individual who shows up with a need. You have a care navigator listening and caring for you, and then you have a prescription that gives you access to this thing. So none of it is on you, and you're guided the entire way through. I mean, I know that everyone here has a background in education. I know that there's probably a lot of teaching artists on this call. Our work in schools is huge. We know that the social emotional learning piece is there, that you process trauma, that you create community through arts work, and then you become an adult and no one's helping you do that anymore, but it's just as essential. And so sometimes you need that care navigator, you need those pieces to help you get to the other part of it and to put it together for you, you know? Um, to illustrate, so I have this great story. Our executive director wears an Oura ring. It's a ring that measures your biometrics, right? Heart rate, anxiety, stress throughout the day. She also happens to be a Tony voter. And so last week she went and she saw 2 shows in one day. And she was like, you would not believe what my Oura ring told me. It was like, you were so much calmer today. You had so many opportunities for non-stressful engagement today. She was like, this is all the proof we need. And as grown-ups, we don't, as adults in the world, we don't get that validation or support. More of that.
Yes. Yes. Um, I see a question from Nicole or Nikki in the chat, questioning or asking about what was the amount of funding received to launch this program and what does sustainability look like in this type of programming. I'll speak to some funding models from Art Pharmacy's perspective, and then I'll throw it to Allie to talk about how they were able to stand this up at New Jersey Performing Arts Center. So at Art Pharmacy, we say this gets paid for in all of the different ways that healthcare gets paid for in the US. That includes health systems, large hospital systems, and community health centers that have funding for public health programs, that have funding for health equity programs, and that have funding for community-based mental health support. We are also working with health insurance plans that are opening this up as a resource to their members, looking at preventative care and trying to reduce the cost of care. We also have philanthropy that is supporting it through research, mostly through research dollars. We have contracts with universities that are looking at student well-being programs and how they are able to support their students across both graduate students, undergrad students, to tap into on-campus and off-campus resources. It is really varied, and it kind of depends on, for us, it depends on the size of the geography that we're working with, and the different areas, you know, trying to build across the state of Massachusetts versus New York City well, I'm not going to use New York City because New York City actually has more partners in our network than the state of Massachusetts, but you know, maybe a smaller region in North Georgia kind of varies. But you know, one of the ways that we think about, so Art Pharmacy is really built for scale. So we are doing it so that Art Pharmacy builds the partnership with the healthcare systems, and we pay the arts organizations that we send people to out of that contract money. There's not yet a code. I say yet, I believe it will come. Speaking into existence for, the ticket to the museum, but there are codes for the wraparound care, the care coordination. And so being able to design a system that can tap into that is our goal to design for scale. Allie, on the other hand, is in that kind of localized system where it's like we're going deep in this community, and so it looks a little different. Allie, do you want to talk about that?
Yes, thank you. Yep, so our model right now is funded primarily through philanthropy at NJPAC. But I will say that since the program inception, we have spent about $50,000 on programmatic expenses, and then another sum of money for the ArtsRx connector role, like the personnel role. And as a new mom and a new high user of healthcare, I'll say, that's 2 childbirths. That is 7 echocardiograms. and that's 700 arts prescriptions across Newark. So the value that the healthcare and health insurance companies are getting out of these arts experiences is an incredibly high ROI for the investment. I think, the kind of the zeros that arts organizations are dealing with in their budgets are a different amount of zeros than healthcare and health insurance providers are dealing with in their budgets. So some things that make us as arts organizations go, ooh, like that's a drop in the bucket of healthcare spending in the US. And something that Dr. Jill Sonke said the other day was, we actually should be valuing the arts more, right? The artists and arts organizations should be paid more for these services now that we know the impact on health and well-being. But just in paying all the arts organizations full price for all of the activities that people have attended, it's been a reasonable budget for us over the last 2.5 years.
Yeah, and I think that is the goal with social prescribing, is that it speaks to the healthcare sector in terms that they value, which is dollars and cost savings. And so to be able to tap into those budgets, that it's not philanthropy long term for Art Pharmacy that is the support. It is the healthcare dollars, whether that is public health dollars. We have partnerships that are using their opioid settlement funds, cities that are using their opioid settlement funds to tap into the arts for prevention and recovery support, or through hospitals, through direct billing. That's the vision.
If I can add, we took lots of meetings with lots of people doing this work, and two things that have stuck with me. Everyone starts small. Even Adrienne and Arts Pharmacy, who have a very big network, you go into a city, you align your partnerships very carefully. You start small and you build. And when Allie walked me through her programming for the first time, I was very impressed with the depth of it. But you're serving, a hundred or so people, right? So you have to start small to build those systems, and that partnerships are absolutely essential. Absolutely essential. Partnerships with your health provider, partnerships with your arts provider. We're in partnership with Arts Pharmacy in the sense that we were like, hey, if you need to buy theater tickets in and around New York City, come to us. We will make sure you have access to discounted tickets so that you can serve the people you are serving. And that's the only way those partnerships are going to work out. Allie did a beautiful job of illustrating to the people in her community that they're actually going to be supporting the work that they do. Allie also referenced Dr. Jill Sonke, who's an amazing researcher who has done a lot of work in this area and published. We all, in fact, saw each other at a conference called One Nation, One People, earlier this year, that published a huge research finding and gave us a whole bunch of free data and statistics around this. So if you want to have a look at that, they have a portal, One Nation, One Project. Sorry, Arts for Everybody. I'll drop it in the chat. But it's very nice research you can look at and use. And for someone who's not a research person, for a layperson, it made complete sense. And I could read through it and be like, I understand these things. So I just wanted to make sure you got that reference, because if this is something you want to pursue, you will see her name come up many, many times.
It's very true. Okay, my next question I'd like to pose to you all is, what does the arts and culture field need to prep to do this work in the community? What do they need to, if I was an arts organization sitting out there listening to this conversation, and I was like, I want to do this. I want to be a part of something like this. Where do I start? What do I do?
I will plug, I'll put our kind of landing page in the chat, that this summer we will launch an education series called Access, which is a lovely acronym for a very long title, but it's called Arts in Community Health Education and Skill Building series. And it's exactly designed for this question, right? What do artists and arts organizations need to understand about arts and health as they kind of engage this work more intentionally? And so there will be a foundations course, a 2 to 3 hour course that's totally free for anyone to access. And then there will be more in-depth 15-hour self-paced online courses priced at $100 or less per course, around arts and public health, arts prescribing, healing-centered practice, and how empowering artists to develop evidence-based programs. And so please sign up for updates on our email list, because we'll be sending out more information about that in the coming weeks and months. And Chris Appleton, who started Art Pharmacy, is on our advisory group for that. And so we're excited to be a resource for art pharmacy organizations, that like these education courses and modules would be accessible for all of the partner organizations for art pharmacy.
Indeed. Yeah, we offer a resource hub that has both, we do orientation and onboarding for network partners, and those that have, both some very easy, very accessible free resources, as well as those that are more in-depth, kind of long courses like Ali was talking about, because we really recognize that different arts partners have different capacity to be able to do that, and being able to dedicate long hours for a course is sometimes a luxury. But wanting to support people who are kind of on that continuum in whatever that interest is. I would say from Art Pharmacy, my plug is that we are here to be a yes and support in opening the populations that are being served. And so, as you are thinking about, developing programs that are in the arts and wellness space, or, building direct relationships with community health centers or schools, bringing bringing school-based counselors into part of the conversation is wonderful. That in addition to kind of you all starting to work on grapple with this, we are also here to be that kind of easy button. And so when we get to the end of conversation, there's a interest form that I really encourage you to fill out to join the network of arts and culture partners in New York City, that we can send folks to as they get referred to us. Yeah. Ginger, any other thoughts as you've been talking to different people?
I think all good thoughts. Thank you for sharing all of it. TDF is very New York centric, but very much aligned with the ideas around everything we've talked about today, and interested in being in partnership with organizations. I kept trying to explain this to other people that I work with, and I was like, it's like the art is the medicine, we're the medicine, they have the prescription is powerful, they bring it here, and trying to figure out how we fit into that great big environment. So I think all that to say that as this grows, and it will grow, it's not going anywhere. This is exciting. This is a growing field. You're going to hear a lot more about it in the coming months and years, and in your practice as teaching artists and arts practitioners. We are very interested in being in partnership and supporting this in a variety of ways. And again, the partnership piece for all of it is absolutely essential.
Yeah. I think the other question that I get from arts partners a lot is, you know, my people aren't, my staff aren't clinical practitioners. Are we going to be able to support the different needs that of folks who get sent to us through social prescribing? And Ali said it, but I just want to reiterate that, in the kind of definition of social prescribing is that these are community-based organizations. This recognizes the protective and therapeutic benefits that arts programs has. So, one, trust in the creative process to do that therapeutic work. It does not require, clinical therapy practice to get those benefits. Um, the other is that in that partnership work of setting up the network of referring providers, it is expectation setting. It's the responsibility of all of us running social prescribing schemes to set that expectation level at the referring provider side that these are for folks who maybe have mild to moderate health concerns that are not in acute crisis, that are not in, in an uncontrolled state. Kind of that who is it for list that Ali talked about around folks who are socially isolated, feeling lonely, looking for connection, have that mild to moderate health concern. Those are all great examples of the different populations that this is a good fit for. And as
And
we
then
think
could
about,
I,
yeah,
oh,
please.
I would just interject to say that, and in success, this frees up the bandwidth of the providers so that they can work to their highest credential and provide services for those folks who are in the acute crisis.
Yes.
In the UK, they saw that, the NHS, right, gets a bad rap for long wait times to see your general practitioner. But they were seeing that up to 60% of those GP or PCP visits were for non-clinical issues. And so if we have folks that are being served in their mental, social, physical health needs through community resources, then we can reserve the clinical resources for those who need it in those times of acute crisis.
Yeah. And I think it's a good filter to think about, as we are in the arts, public facing, public serving institutions, the filter of how do I, work with somebody who's maybe been prescribed art, I think falls really well in line with healing-centered, trauma-informed practices that we look at in the education space. And that is a skill that is already really deeply embedded and valued in the arts and education field. And so those are co-supportive.
Completely co-supportive. And I think there was a beautiful example. Maybe Ali, you said this at the conference we were at, but someone was talking about what if you could pull up your My chart and in the same way that you say to your provider, I pulled my back out again and I need those muscle relaxers. I've just been feeling really lonely and out of sorts. I think I need to go to a pottery class and could get the same support immediately, qualified and legitimized by that health institution. What a wildly different world we would be living in.
Mm-hmm. I have a story that was just heard last weekend from one of our Arts RX participants because I was like in space with her when she like stood up to ask other people a question at a conference, and she was like, I just moved to Newark from California. I'm in med school. I hurt my knee, and so I was homebound a lot. And I'm a social person. Like, I need people. And I was lonely and I felt like I was going a little crazy. And as I was talking to my doctors, I was saying, I need to be around people. I need something different. And, they're like, well, do you need mental health support? Do you need this? She's like, no, no, no. I don't know. I need to be able to get out there. This is a new city for me. I'm feeling lonely. And so then, I'm feeling not great. Yes, I need help for my knee, but then now my knee's feeling better. I need to be out and about. And that doctor was a part of our Arts RX program and referred her into Arts RX. And so, she was at NJPAC at an event that she got a prescription to attend and kind of be with and meet people in community in this art making space. And I was like, that is a success story. I was like, can I have your phone number? Can tell me more about your journey? But like, that's the type of, experience that is like, kind of a exemplar for programs like this. I'm not feeling great. And I have a fever and I don't need more cowbell. I need community.
Yeah.
I see a long question in the chat.
It's actually a great reflection that I want to read out so that everyone can hear it from Arlene, saying, this is interesting because as a longtime teaching artist and facilitator, I've long modeled my workshops with whole health in mind, but have never been interested in being a clinician. This bridges that gap in such a wonderful way. I'm currently an education case manager for 2 health programs at a community college, and I marvel how separate artistic practice is seen from healthcare. The need for arts integrated into all our society is so obvious. Yes, 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 yes. And I think being able to go out and speak with confidence as an artist and not a scientist. I put those both in quotes because those are not necessarily distinct. Um, but often sometimes as artists, we don't necessarily feel confident in making those claims. And being able to look at some research and being able to say, no, there is a distinct evidence base for the work that we do and its impact on mental and physical health, um, starts to change the narrative culturally. One of the things that our CEO, Chris Appleton, often says, and I think it is so true, is that, 50 years ago, exercise wasn't necessarily thought about as part of our health. And now that seems just wild that, you know, 50 years ago, if your doctor said, oh, you should go out and, keep active, keep walking, that was somehow new and novel, and that hopefully in less than 50 years, that will not be the new and novel surprise if when our doctors say, go out and, take a clay class or go visit the museum. So
100%. And I think too, like, and to think even further back, 50,000 years ago, art was not separate from health. 100,000 years ago, art was not separate from health. We have been making art our entire humanity. It has been part of how we connect with one another, how we communicate, how we heal, we ritualize, make special, make meaning. And this is just a remembering of things that our culture, and I say our as kind of white colonial Western culture, has forgotten or segmented or siloed apart from our health. So this
yeah.
is just a remembering that the arts and creative expression are really a part of our humanity.
Here, here.
I am keeping an eye on the clock. We've got about 15 minutes left. I really encourage folks to continue to drop questions or comments in the chat if you're having them. But Kinsey, would you mind sharing screen again? We've got a couple of resource slides that we want to share with you all before we sign off. I want to give us time to talk through that. Cool. So this is the link that you all can use if you have programs that you think would be great for us to send people to that are open to the public. You can use the QR code to fill out the interest and enrollment form that will get you started in joining the network of art pharmacies cultural partners. Give that a minute, bullet capture, and then, no, that's okay. You can go ahead, Kinsey. We'll share.
This one is from me. Please scan the QR code and mark your calendars for creating healthy communities, the arts and public health convening. This happens only once every 3 years. And this year it is in Newark, New Jersey, hosted by NJPAC. The conference proceedings will take place on the 15th and 16th with a whole day of arts prescriptions on October 14th. So you'll be invited to come participate in our arts activities all across the city on the 14th. We'll be talking about understanding arts participation as a health behavior, establishing access to the arts as a social determinant of health, the economics of arts and health, which we touched on today, that kind of ROI, some really huge reporting done out of the UK and Canada recently. And then a whole kind of half day on arts prescribing on the 16th. So please, if you scan the QR code, there will be a place to sign up for updates. We anticipate registration opening in May. And accessibility is a big part of this convening. And so we'll have scholarship applications opening in May as well.
All right. And this is my top, however many this is, reading list. If you are curious to learn more, The Connection Cure is a book by Jules, her last name is escaping me. And she talks about how social isolation is killing us, and that by coming together and creating healthier relationships between folks, we can cure ourselves. The Neuro Arts Blueprint is the runner-up to Your Brain on Art book by Susan Maximin and Ivy Ross. That is where the quote that I shared earlier about our bodies being wired for art comes from. And there's a couple others here that are some more kind of academic articles that kind of get into utilization information and that kind of thing. So further reading at your leisure. These are all of our contacts. I will be at the in-person days next week on both Wednesday and Thursday. So if you are around and want to meet up in person, have further conversation, ask questions, please come find me. You can either email me ahead of time and we can set up a time to meet, or come and grab me in a passing time.
Thank you all. It was lovely to share the space with you today.
So I see there have been some more things in the chat. I don't know if there are any questions. I think there's a lot of gratitude. for what you've shared today. I just want to make sure that we're not missing any questions. I don't think so. And for folks who were asking about the codes, it looks like all of the links have been shared in the chat. So this is great.
There's one person had mentioned that the Arts Pharmacy code wasn't working. I opened it in Chrome and it opened right up. So just maybe try to change your browser.
Alrighty, well, we do still have a few minutes, so if you have a lingering question, feel free to put it in the chat. And while you're doing that, I just want to say thank you so much to you three for joining us today, for sharing all of this incredible information and the anecdotes and experiences as well, and all the work that you're doing. It's so wonderful to have you here to share with our community. So thank you for putting this presentation together for us today. I also want to let everyone know who's on the call that in addition to this being recorded, I did all of the links that were shared in the chat, as well as all the links for that like recommended reading and resources. I have collected all of those and they are going to be sent out in my resource follow-up email along with similar items from all of our other virtual sessions and recordings and all of that fun stuff. So you'll be receiving that from me likely after probably actually next week. But TBD exactly when. I don't see any other questions. Oh, well, what I should say, go ahead, Adrienne.
Actually, yeah, I will say, Chris Parker put in the chat, what about Lifetime Arts program? And they are wonderful for teaching artists and programs that are looking to work with older adults and learn more about creative aging. Fabulous organization. They have an amazing resource library also as a place to tap into.
Amazing. Thank you. And then I will also just share that face-to-face the virtual week of face-to-face is not quite over yet. So we do have 2 more sessions coming up. The next on deck is tomorrow morning, April 10th at 10 a.m. Eastern. We have Intentions versus Reality, Applied Theater Strategies for Addressing Practical Challenges. And then our final virtual session will be on Friday morning, the 11th. That is called Skimming the Surface, Healing and Embodiment Through Expressive Movement. And that will be an active session as well. So if you would like to learn more about those sessions themselves, you can read their descriptions and read about the presenters on the face-to-face schedule website. I can drop that link in the chat as well. And otherwise, I think that we're there. So thank you all again. This has been such a wonderful hour and a half to spend with you all. Thanks for joining. And I hope that we will see you soon.
Thank you all.
Thanks,
Thank you. It's a
everybody.
pleasure.
Thanks, Kinsey. And thanks so much, Lucy and Thalen as well. And good to see you, Adrienne and Allie.
Me too.
Thanks, everyone.